If it's a true heart attack and you're having that heart attack, the pain will come on suddenly. But some patients can get sort of pains related to blockages in their arteries, maybe several days before their heart attack, or worsening pain before they have their big heart attack.
All right. So now, when you know you're having a heart attack, what's the first thing you can do to control or to avoid or to cease the pain?
If you're having a true heart attack, then there's no alternative. You must seek urgent emergency medical attention. So in the UK, we would encourage all patients to dial telephone number. In our country, it's 999, and you get the ambulance in, because basically these patients need to be treated in a heart attack centre. Generally, they'll get a stent, open up the blockage. There's nothing you can do to open up that blockage yourself. You could, while you're waiting for the ambulance, take some aspirin. That can sort of help.
Aspirin under the tongue?
Or just crush the aspirin and swallow the aspirin is probably the best bet. And that can sometimes help sort of, it won't dissolve the clot, but can help minimize the clot.
All right, but now there's a question. For example, you're having a heart attack.
Mm-hmm.
Do you naturally get that time where you can actually help yourself in dialing it to the doctors or waiting for the ambulance, or you could do something to cease the pain? Do you think there's that much time where you can actually do something when you're having heart attack?
Yeah, I mean, believe it or not, some people can have a heart attack and it feels like they've just got a bit of indigestion. It doesn't have to be a severe, crippling, disabling pain.
There's a few certain percentage who are actually lucky to survive after first heart attack and even second and then third. There are certain cases, but there are also those cases where we have seen direct death of after just going through first heart attack, maybe a heart attack.
Depends where the heart attack is, which part of the artery is blocked. If it's in a big artery that's supplying a big part of the heart, then unfortunately it can be fatal in those patients. But I think most people would survive their first heart attack if they are brought to urgent medical attention quickly.
So, for example, there is an actress, Shishmita Sen, who had heart attack back in February 2024. But now she's surviving, and she is a survivor. But she has been enough lucky to survive through that heart attack. Otherwise, you see that people just directly have a silent heart attack, and we are unable to see them again. So when you have a silent heart attack and you are a patient of diabetes, how can you know that silent heart attack could hit you one day?
It's hard to know because the symptoms can be very vague. The main message I would like to get out is if you feel as though you have anything that could be related to a heart attack, you mustn't delay and you must go and seek urgent medical attention. There's nothing you can do to treat that heart attack, to improve your prognosis beyond getting to urgent specialist care.
All right. So what do you suggest to the young generation, how they can maintain their healthy lifestyle to avoid such diseases, even if they have in their genetics, or even if they have history in their family of heart attack, or if not?
I mean, heart attacks are so common, particularly in this country. It would be very uncommon for someone not to have a family history of heart attacks. So what we want to identify are those patients who have a family history of early heart attacks. So if anyone in your family, especially first degree family, has had a heart attack or a stroke, it's the same process, below the age of 55 in a man, or 65 in a woman, then I think you should be proactive and ask your family doctor. I'm sure they can have access to these tests to check things, common things like blood pressure, cholesterol profile, make sure you haven't developed early diabetes. And if you have that type of family history, it just means you have to be even more strict on your diet and lifestyle.
About it, right?
You have to work even harder.
Vigilant.
Because you've probably got genetics that are working against you.
Yes. Any stage of your life, and you never know about it.
Yes.
It can hit you any part of the day. And since you're talking about the tests, that you have to check your BP every other day, or maybe once a week or twice a week, is there any other test as well you can actually do?
So blood pressure, the best way to check your blood pressure is actually twice a day for a week, and then every 6 months. So I don't want people to check their blood pressure every day.
Every other day they would be
just for 1 week, check it twice a day. That's the recommendation. And if it's fine, then do that every 6 months. If you've got that type of family history, you need a blood test to check your cholesterol profile. There's quite a few parameters you need to check, but your doctor should know which tests to do. Some people are genetically predisposed to have a high level of something called LDL cholesterol. And this is very dangerous cholesterol if it's high, because that will also accelerate the furring up of your arteries.
All right. And those who have a paunch,
Yeah.
Does it lead to heart attack?
It's a big risk factor.
So
Even
please
if you're
tell
a
to the
norm-
audience that this is the biggest factor.
Even if you've got a normal weight, believe it or not. So some people use a very crude metric called a body mass index, which is not a bad metric, but for South Asians, I don't think it's sufficient, because a lot of South Asians actually are not technically overweight, but they do have a lot of fat distributed around their abdomen.
Right.
And that fat surrounds your liver, your pancreas, your kidney, your heart. And
Your
as I
gut.
said, that is a very dangerous fat. It's
Yeah.
completely different to fat under your skin,
True.
on your hips and thighs, and it can really accelerate cardiovascular disease risk.
True. So in every other statement, you pinpointed South Asian society, where there is high risk of having heart attacks every other day. And it's increasing, and we can't deny the fact as well. And you are also here to attend the conferences and also give counseling sessions, representing as a British Pakistani doctor.
Yes.
But I would like to know about the Western society as well. Do they face such issues? Is there any increasing percentage of heart attacks in Western society as well or not?
It is, but perhaps not to the same degree. But certainly we see patients of white ethnicity getting heart attacks in their 30s and 40s. It's less frequent, but it can happen because anybody can have genetics that predispose them to early.
But why? And how's that possible? What's so special in their diet or in their lifestyle which we lack? I would rather ask.
I think Western society is getting just as unhealthy in some instances.
Yeah,
I've seen
true.
a lot
On
of
the
them
other
are-
side, yeah.
I think a lot of societies are getting less active. A lot of us are spending more time in the
Lazing
office.
around,
COVID has now meant a lot of people are working from home. They're perhaps not doing as much exercise.
sitting on couch for next 24 hours, working from
Absolutely.
home.
Absolutely. And then also when you're working from home, you tend to eat more. You're near a fridge. So the lifestyle it's really the lifestyle
Has
that
turned upside down.
turned upside
But
down.
no, here my question was that how the risk of having heart attack in 30s or 40s in Western society is lower than Asian society.
Genetics, and we can't explain that. So we just know that Asian societies tend to have genetics that predispose them to more diabetes, more abdominal fat.
Because of the health or the lifestyle or the food intake.
No, genetics are just something that's part of you. You can't change
You
that.
can't change
You
it
can't
and you
change
can't-
that. It's just part of your makeup.
All right,
Unfortunately,
all
I
right.
wish we could. I wish you could exercise away bad genetics, but you can't.
All right. Before we wrap up the conversation, I would like to know about your experience being in Pakistan and attending the Lahore's conference today. And also you're traveling to Peshawar and then Karachi and then Islamabad. How do you feel about it? How's your experience? What did you perceive out from the conference, and what did you analyzed about the information the doctors have about heart attack? Or what would
Well,
you
firstly,
say? It's a critical question. But
Yeah, no, but I mean, firstly, it's a huge pleasure to come back to essentially, I mean, I was born in London, but I always consider Pakistan to be my sort of home country. So it was a nice experience there. And I was very pleasantly surprised, actually, at the level of expertise of your local clinicians. But I think they're just perhaps a little bit overwhelmed by the quantity of patients with these risk factors. But I've got no concerns whatsoever about the level of knowledge and quality of care that they are delivering for their patients.
So you think they lack? They're lagging behind?
No, they're not. I was very impressed by the quality of their
All
care.
right, you're impressed by the
Yeah.
quality. So
Yeah.
what would you say, what your expertise says, is there anything room for improvement or something we should add in our health system?
I mean, that's a political question. I think it's all about resource. And I think the more you resource and fund the treatments, a lot of the treatments that we're talking about for diabetes, cardiovascular disease, lowering your cholesterol, they're very expensive. We're fortunate in the NHS, in the UK healthcare system, that the government subsidises and funds that treatment. That's probably the major difference.
And we're lagging behind here in
Yeah, I think
Pakistan.
from what I can gather, a lot of patients have to pay for their own treatments, and if they
Huge sums of money,
it
yes.
becomes an affordability issue.